So what do you need to know about taking antibiotics? Dr. Natalie Azar is an NBC News medical contributor. Dr. Azar, good morning to you.
Good morning, guys.
30%, that's 47 million prescriptions. That's a lot.
It is a lot. And antibiotic-resistant bacteria are a big problem. They can cause up to 2 million infections per year and 23,000 deaths, according to the CDC. So it's not a small problem. But in addition to antibiotic resistance, overuse or indiscriminate use of antibiotics can lead to life-threatening, sometimes allergic reactions, drug interactions, also a potentially life-threatening diarrhea caused by a bacteria that's named C. difficile. So it's not just the antibiotic resistance, but of course that's the focus of the CDC's study.
But here's the dynamic. People come in and they tell their doctors, I want antibiotics. I know I need them. And a lot of doctors just think, oh, you know what? I'll give them to you. It's easier than trying to explain why you don't need them.
Right. And so as Tom pointed out in the piece, there are a number of conditions where there's really no question you need to treat with antibiotics. Certainly if you suspect or document a bacterial pneumonia, streptococcus causing pharyngitis or a sore throat, as well as pneumonia complicating bronchitis. And you can see the list coming up on the screen. And something that's important is the sinus infection. So let's say you have, that congestion, nasal congestion for a couple of days, you get better, but then after about 10 days, you get sick again with fever of 102.2, sinus pain, purulent or pussy discharge from the nose. That probably viral sinus infection has turned into a bacterial one, and you do need antibiotics.
Real quickly, you're a parent, your child gets prescribed antibiotics by a doctor. Do you question it? Do you say, I don't want my child to have antibiotics?
You know what I said yesterday to my team? I said the best treated patient is the best informed patient. And I would say to you that every time your doctor prescribes antibiotics, just ask the question, what are you treating? Are you just treating a sore throat? Are you just treating an uncomplicated bronchitis? What is the bacterial infection that you're treating? Because that's really the main distinction. And a point, too, I'd like to make is that if you are given antibiotics and it is justified, complete the course of antibiotics. A big problem is that people start to feel better after 2 to 3 days and assume that their infection has been treated. It's really an anti-inflammatory effect of the antibiotic. We do want you to complete the course to avoid resistance.
Good information as always, Natalie. Thank you very much.
Guys.